The Deputy Premier, who will be giving us some news on the regional areas, that is some positive news, and Dr Gale, who will be talking about some of the other issues that needs to be dealt with in detail on health. So I start by advising that there were 1,351 locally acquired cases here in New South Wales to 8 p.m. last night. There were no overseas cases. Tests-wise, there were 129,266 tests to 8 p.m. last night, and I would encourage the community to continue to get tested with any symptoms whatsoever. Health needs that information in order to be able to make the decisions that are undertaken to make us or keep us safe. The vaccination rates. New South Wales administered 29,976 vaccines in the period to 8 p.m. last night, the 24 hours to 8 p.m. last night. There were 4,721 vaccines administered at Sydney Olympic Park and 6,254 at Kudos Bank Arena. Across New South Wales, 80.1% of the over 16 population has received a first dose of COVID-19 vaccine, and 48.5% of the entire community over 16 are fully vaccinated. Just want to thank the community for coming out in such strong numbers to be vaccinated, because there's now almost 8.5 million people in New South Wales that have had the vaccines administered to them. The cases in hospital, there are now more than 15,000 people with COVID-19 who are being cared for in our New South Wales health system. The majority of those, over 90%, are being cared for in the community, at home generally, and some are in the New South Wales Health Special Accommodation. Dr Gale will give more information in regard to that. Sadly, 12 people passed away up until 8 p.m. last night. There were 6 ladies and 6 men. These people were in a range of ages, and I just want to stress that the range of the ages reflects the fact that this is a very severe disease and can impact you at all ages. And for those who are still reluctant to go and get vaccines, can I say that is the way forward. You need to go and get vaccinated. One person was in their 40s, one person was in their 50s, 4 people were in their 60s, 2 people were in their 70s, 3 people were in their 80s, and 1 person in their 90s. And I want to stress that of those 12 people who passed away, 10 people were not vaccinated. 10 of those people were not vaccinated. I want to express, it's just whenever we lose a family member or a friend, it impacts on every one of us. And I just want to express my condolences, and I'm sure all of the condolences from New South Wales Health. Staff there care for each and every one of these people. And my sympathies go to all of the family and friends of each of these people who've passed away. Dr Gale will give more information in regard to those cases as well. In terms of the regional areas, there was 1 case in northern New South Wales to 8 p.m. last night. In the Illawarra, there are 44 new cases reported in the Illawarra. That brings the total in that particular local health district now to 502 cases. 21 cases are from the Wollongong local government area. 20 cases are from the Shell Harbour local government area. 2 cases are from the Kiama local government area, and 1 case is from the Shoalhaven local government area. In Western New South Wales, there have been 27 new cases reported to 8 p.m. last night. This brings the total to 1,004 cases in that area. Dubbo had 12 cases, Bathurst had 6, Walgett and the general region had 6, Burke had 2, and Wellington had 1. In the far west of the state, there were 2 further cases in Broken Hill. In the Hunter, there were 16 new cases across the Hunter, New England Local Health District. This brings the total to 367 since the 5th of August. Of those 16 new cases, 6 are from Lake Macquarie Local Government Area, 5 are from Newcastle Local Government Area, 3 are from Cessnock Local Government Area, 1 is from Gunnedah Local Government Area, and 1 is from Port Stephens. On the Central Coast, there are also more cases. 23 new cases have been reported in that area, and that brings the total in that local health district to 312 cases. In the southern New South Wales area, there have been 3 new cases. One of those cases was in Yass, 1 in Jerrabomberra, and 1 in Queanbeyan. In the Southern Highlands, there have been 2 new cases. I'm going to ask Dr. Gale now to give further information on the relevant cases, but I also want to just finally say that there is some good news, which, as I said before, the Deputy Premier will go through the local government areas that are coming out of lockdown. But there are 2 areas that unfortunately will have to go into lockdown. One is the local government area of Lismore, and one is the local government area of Albury. Dr. Gale will give a little more information on the basis for that, but suffice to say there have been positive cases in both areas. Can I say that I express my sadness to the local community that having been free of that for a little while, having to go back into lockdown, but it is for your safety and for the community's safety more broadly. That lockdown will occur as from 6 p.m. today. Health has made a decision that the period of lockdown initially will be 7 days. Now, the reason for that is to try and get a handle on what exactly is going on in the local areas. In the normal course, more often than not, health determines that it will be 14 days, but in this case, looking at the issues, health has determined that 7 days will be appropriate, but I'm just warning the community that it may be longer. We really need each and everybody in those 2 communities with any symptoms at all to come forward and get tested, because that will allow health to make well-structured decisions based on the information that's available. If the local residents don't come out in great numbers to get tested, then that presents challenges for health to be able to determine what is and is not appropriate in that area, and would obviously operate on a more precautionary principle. Can I also say that in Albury, that area is principally managed through the Victorian health system, of course, the Albury-Wodonga system, but New South Wales Health will be establishing some additional pop-ups for testing in that area, and there are a range of opportunities for vaccinations in that area, including GPs and also the service that is operated through the Albury-Wodonga service. But we'll be doing everything we can to make sure that people do have access to vaccination. So again, in both of those areas, the message is get tested. If you have any symptoms at all, get tested. Or if you've been anywhere near as a close contact, get tested. And please, 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 if you haven't been vaccinated, don't delay, get vaccinated. We know that vaccinations save lives. Vaccinations stop you or at least reduce your chances of ending up in hospital or in ICU or dying. And of course, it also saves other community members from getting the virus and being in a situation where they could be exposed to any of those risks. I'm going to ask Dr. Gale now to add to what I've said, and then I'll ask the Deputy Premier to also give us some information. Thank you.
Thank you very much, Minister, and good morning, everybody. As the Minister said, to 8 p.m. last night in New South Wales, we report 1,351 new locally acquired cases of COVID-19. We're really pleased to see people continuing to come forward for testing in the numbers that you are, and we're also really pleased to see the vaccination rates increasing at the rates they are, as the Minister outlined, and particularly in some of those areas of concern in those 12 LGAs, the community has done a fantastic job in coming forward in such great numbers and seeing such a rapid rise in vaccination coverage in those areas. So a big thank you to the community, and a reminder as well to please book in for your vaccinations if you haven't done already. There are plenty of opportunities through your GPs, through opportunities in local pharmacies, and as well in state hubs in New South Wales as well, both at the Sydney Olympic Park, please book in, and also at Kudos Bank Arena, where they particularly have a lot of AstraZeneca available for anybody who wants to receive a vaccine. You're welcome to just walk in to the Kudos Bank Arena. They will register you and you'll be able to get your AstraZeneca shot there. So I'd encourage anybody who hasn't yet got their vaccinations, their first dose or their second dose, to please book in at any available opportunity to do so. There are currently 1,231 COVID-19 cases admitted to hospital. 231 people are in intensive care, and 108 people are currently requiring ventilation. Of the 231 people in ICU, 177 are not vaccinated. 49 people have had one dose of a COVID-19 vaccine, and 5 people have had 2 doses. As the Minister reported, we're very sad today to announce the deaths of 12 people from COVID-19. As the Minister said, they are in a range of age groups. And again, particularly, we remind everybody of the importance of vaccination where there is strong evidence of preventing serious disease and preventing death. I'd like to give you a few more details about some of the individuals who passed away. There was a woman in her 60s from southwestern Sydney who died at home. She had underlying health conditions and had received one dose of vaccination, and she was being cared for in the community by New South Wales Health. We report also a man in his 90s from Western Sydney who died at Westmead Hospital. He had acquired his infection at the Hardy Guildford Aged Care Facility, and this gentleman's death is the second death linked to the outbreak at this facility. We are also aware of the death of a woman at home in Western Sydney yesterday. We understand that she had some significant underlying health conditions for which she was receiving treatment at Blacktown Hospital. This lady had tested negative for COVID-19 in recent days. However, she was also in contact with people who did have COVID-19, so the circumstances of her death are being further investigated by the coroner. Again, it's always really upsetting every day to be announcing deaths from people from COVID-19, and again, my heartfelt sympathies go out to the families of those individuals who have lost their lives. I'd like to now move to giving you an update on some of the sewage detections that have occurred. We continue to have a very robust sewage surveillance system, which is very important, particularly for our regional areas, to identify areas of where there may be undiagnosed cases and where we need to focus our efforts and where we ask the community to come forward for testing. So I'd like to particularly ask the residents of the following areas to monitor for symptoms and come forward for testing, and those are people in Gunnedah, Inverell and the Hunter-Karua areas, Coffs Harbour, Cowra and Young, and also Narooma. As we have seen in recent weeks, we continue to see the highest number of cases in areas of Western Sydney and southwestern Sydney, and particularly I ask the residents of the following suburbs that have the highest case numbers to continue your wonderful efforts to follow the public health advice, to come forward for testing and to take any opportunity for vaccination. And they are residents of Greenacre, Guildford, Auburn, Busby, Bankstown, Marylands, Blacktown, Punchbowl, Liverpool and Yagoona. I'd also like to particularly encourage people who live in the suburbs around the Parramatta area and the Liverpool area to make a special effort to come forward for vaccination. We really want to see your vaccination rates even higher than what they are. So please, for residents of the Parramatta and Liverpool areas, please book in for your vaccinations as soon as you can. In relation to what the Minister mentioned around our concern about the area of Albury and also Lismore, I'll start with Albury. We have 2 cases in Albury where we are unsure of the source of those infections. There are possible links to Sydney. However, that is under investigation by the local public health teams. Those 2 people appear unrelated to each other. There are a number of exposure sites in the Albury area and those issues are being worked through by the local team. And so I'd ask everybody living in the Albury area to please be vigilant for symptoms. Please come forward for testing. In terms of Lismore, we report 1 case in Lismore, again with a possible link to Sydney and again with exposures in the community around Lismore. So for residents of Lismore, again, we ask you to please monitor for symptoms, pay attention to the public health advice and come forward for testing promptly. Thank you.
Good morning, and firstly, can I start by offering my deepest condolences to the families of loved ones who have lost loved ones overnight, and you remain in our thoughts and prayers. Last week, of course, we made announcements about lifting restrictions and stay-home orders in large parts of regional and rural New South Wales. And after a week, it has been successful, but we've also seen a couple of areas go back into lockdown as per the criteria that we set. We also indicated that on a weekly basis we will be evaluating other areas and local government areas in regional and rural New South Wales that could come out of lockdown, out of restrictions. And today I can announce a further 12 local government areas in regional and rural New South Wales. Those areas are Bega Valley, Blaney, Bogan, Cabon, Dungog, Forbes, Muswellbrook, Narrabri, Parks, Singleton, Snowy Monero and the Upper Hunter Shire LGAs. So today, good news for those communities. But my message is simple. Remain vigilant. Get tested if you have an onset of symptoms. Please minimise mobility as much as possible. This is a good news day for regional rural New South Wales. You join other communities that have their stay-home orders lifted, reminding everybody that it is a restricted environment still with the new orders in place. If you can avoid going to a local government area where there continue to be in lockdown, please do. And a reminder that if you do visit a local government area that is in lockdown, the reality is those stay-home orders then come back with you. So the reality here is minimise mobility. We know we have cases in regional and rural New South Wales, but listening and the advice from and the update from Minister Hazzard, clearly it's stabilised in the regions and we want to remain in a place where, again, numbers aren't rising or escalating to any higher degree than what we're seeing today. Vaccination is the key. Vaccination continues to be the key in regional and rural New South Wales. We know there is an abundant supply of AstraZeneca right across the regions, and I encourage everybody in regional and rural New South Wales to continue to get vaccinated. We know Moderna is coming online with our pharmacy networks, and of course Pfizer is available through GPs and some of our health networks, but we also know there is a supply shortage on Pfizer. So today I encourage people to continue to get vaccinated, to remain vigilant, get tested if you have symptoms, support your communities, and more importantly, take a modest approach about movement, because we want to make sure that we don't stand here at press conferences locking areas down. It is unfortunate for those communities that have an opportunity for freedom and then, of course, lose some of those freedoms. So again, congratulations to those areas. You're doing the right thing to those communities. But again, my message is get vaccinated. Thank you.
Legitimate, and do you know how many passengers were exposed?
I have no further detail on that. Happy to give you a further update today. But there are authorised workers. There are permitted to leave Sydney. There are people that are allowed to leave for a number of reasons. We've got a permit system in place. We have testing arrangements in place. Transport is important in regional rural New South Wales. We still have to function as a society, so there are certain activities that have to continue. But that does mean there's a level of risk. But I can come back to you with further detail.
Deputy Premier, following the case that's been confirmed in the Glen Innes area, how likely is it that you are going to lock down that region later this afternoon?
So we work with the advice from Health, and we get updates right up to this morning. And the Glen Innes case that's been notified overnight, that's post the 8 p.m. Reporting period. We'll work with the local health team. When we have further information, we'll give that community an update. No different, the cases in Albury were identified yesterday. Lismore was last night, and that's why we were able to make the decisions today. So we'll do that in a very measured way before a knee-jerk reaction about locking down the area.
Can you give us any more information about the case in Lismore, what we know so far?
Look, I'm aware of some of the details around the Lismore case, but often that there are privacy issues. I'm not sure what we should be saying publicly. I can refer to Dr. Gale if you like, but look, we know that there was a parent that returned back to Lismore with their child. It was an exposure in the school environment as well, so that there is issues there. We don't know how much that exposure looks like, so we've made the right and appropriate decision to lock down Lismore.
What impact will that case have on arrangements at the border, if any?
Well, again, we'll work with the cross-border commissioner. We opened up the Northern Rivers, we've opened up the Tweed, we've worked hard with Deputy Premier Miles in Queensland, not only to open the border, lift restrictions and put in place a border bubble. Today we'll reach out to Queensland, make sure we have all the information, but as I said, we've made a decision to lock down an area for the health and protection of that community. We'll now work around what happens with the bubble.
We're just days out from school holidays. Does that play on your mind with the situation in Glen Innes and Gunnedah?
Yeah, well, it does, and I know we're only days out, a week out from school holidays, and the reminder to everybody is that we still have cases in regional rural New South Wales. We still have areas that are under stay-home orders. And the reality here is it's not these school holidays you should be travelling. Again, I encourage people to stay home, only travel if they need to, and avoid areas that there are cases, avoid areas that are under lockdown conditions. More importantly, I believe this is a time when you've got freedoms in some parts of regional New South Wales. Stay home and spend that time with family, because it is a freedom that you have.
A lot of income and business support, obviously the state-federal differences, is based on prolonged lockdown, 7 days to a fortnight plus. Does that leave towns and areas who have come out of lockdown on the weekend and back in short in terms of businesses and people who are losing work and hours?
Well, firstly, from a state perspective, a lot of the government support from a state perspective is directly to businesses. So the JobSaver payments are linked to businesses that have an impact on turnover, impact at a threshold of 30%, and we pay up to 40% of the payroll. In doing so, we support those businesses, and even in those areas where we've lifted restrictions for those businesses, if their turnover continues to be a loss above the threshold, they will still are able to receive JobSaver payments, but they are meant to report every 2 weeks to make sure that we have an updated arrangement. In relation to the emergency payments that are directly to employees that lose hours, there is concern there with the federal government. I've asked Treasurer Perrottet to give me an update and to give the government an update on what those arrangements may be, but I understand that the federal government has already notified individuals that in areas that are now not deemed hotspots, that they no longer will be getting those emergency payments. But there, again, I've asked Treasurer Perrottet.
Deputy Premier, the Everest at Royal Randwick going ahead at October 18 with fully vaccinated people?
Well, look. Firstly, I know there's been a lot in the media over the last 24 hours in relation to the Everest. I can tell you there's been no decision by the government about the Everest. If the Everest was to open, the Everest will be running on that date. If the state has opened under the 70% roadmap, the capacity at the moment is 5,000 people. So I just want to put that into context that any organisation, any event that happens while the 70% roadmap is underway will be running with a capacity of 5,000. Of course, there are abilities for people to seek exemptions, but I've got to be honest, I don't think that would be appropriate at a very early stage in the 70% roadmap. But we don't know exactly when the 70%, as much as we projected, mid-October. Does it fall before or after the Everest? Well, we don't know, and those organisers of the Everest will have to take into account that they may be running their Everest under today's conditions.
Mr. Hazzard, if I could ask you a question. businesses say they need to know now, in order to prepare for that 70% mark, what those public health orders will look like. You sign the public health orders. Who will be liable if an unvaccinated person goes into a pub, a restaurant, a club? Will that person be fined and the business be fined? What will those public health orders look like, and what will be required of business to enforce those public health orders?
Look, obviously everything we're doing at the moment is centred around encouraging everybody to get vaccinated. And if you're double vaccinated, then the government is certainly very keen to see you out and about enjoying more of a life that we used to have. Businesses, of course, are required in a similar way to have their staff double vaccinated at that point. I'd like to see them double vaccinated today. But anyway, when they open, hopefully they will all be vaccinated. As to the function, if someone were to enter a premises who is not double vaccinated, then obviously that person is liable for a very substantial fine. So it's incumbent upon individuals to make sure they comply with the law and the health orders.
Will businesses be liable at all?
Sorry. None of these health orders please me or any of my colleagues to have to put them in place. If we weren't in a 100-year pandemic, I'd be absolutely delighted, as I'm sure everybody else would be. But that's the reality. And I think as far as employers or businesses go, it's more difficult. But those issues have to be resolved in the next few weeks. But I just remind everybody that individuals themselves, it is incumbent upon you not to enter premises unless you are doubly vaccinated. And that's the key message.
Yes, the owner of three local
I'll come back to that.
The owner of three local clubs in Tamworth says he has 130 staff and very few of them are going to be fully vaccinated by the 70% target. He's calling for one vaccination for staff at 70%, perhaps in regions where there are no cases. Otherwise, he's not going to have any staff to operate. What's your response to that?
Look, I understand what he's saying, but I think the simple message is people do have to go and get vaccinated, get their double doses. There's been plenty of time to do it. So I would say to him, encourage his staff to go and get doubly vaccinated. It depends on the time periods. Perhaps they're confusing if they're having the AstraZeneca. The normal period, the normal intervention period or intervening period is about 12 weeks. But that's been announced by Dr. Chan and Dr. Gale, that you can certainly have that far quicker, so you can have it after 3 or 4 weeks if necessary. So it's quite possible. Just go and have the double vaccinations.
So the city of Sydney,
I'll come to you next one, sorry.
The city of Sydney LGA has a higher number of active cases, a higher number of cases per 100,000, and a lower vaccination rate than the city of Parramatta. One of those areas is a hotspot and still an area of concern. The other one isn't, and they have similar population sizes. Could you just explain the rationale behind why that is?
Look, Dr. Chan and the entire public health team have a very difficult task of looking at each of these areas. LGAs, to date anyway, have been chosen as the boundary that's a little easier to deal with and to communicate to the public. But there's a whole lot of factors that come into that, as we've, I think, said many times in these press conferences. It's not just the absolute numbers, it's whether or not the numbers are actually, or the people, not numbers, the people are moving around, or how they're moving around in the local area, or what the risks are with that movement. There's so many factors that come into it, so it's not easy to convey that, but just let's say that the government is very keen to actually move as quickly as possible to remove any LGAs out of being LGAs of concern if we can do it. But at the moment the advice has been such that no, we can't. Just go with Ashley and I'll come back to you. Yeah. Oh, sorry. Sorry, Ashley.
One of healthcare workers still aren't vaccinated. You were saying before people have had plenty of time. Is this a sign that this proportion simply don't want to get vaccinated? And if that's the case...
Well, I don't think it's that simple. I mean, look, health workers initially, as you'd recollect, were there were limited numbers who were allowed to be vaccinated. Initially it was thinking back, I mean, time moves on, but I think it was emergency department workers, intensive care people, theatre people. And so not everybody has had that opportunity to have the vaccine for as long a period as others. And I did see that article today, but I just want to point out that in some cases, I know the Sydney area is quite amazing. It's up over 90% already. In other areas, it's 88%, I think, more broadly across the state. So that's for the first dose. I think about 81% for second doses in some areas. There are areas that are a bit less, as you might expect, to some of the areas up on the north coast that traditionally have certain reluctance. But generally, I think the health staff are doing a really good job. I mean, I'll rephrase that, the health staff themselves are doing a fantastic job, but in terms of vaccinations, they're getting there, and we've still got a period before they all have to be vaccinated. Sorry, Ashley.
There's been an outbreak in social housing towers in Redfern, and we've heard a lot about concerns about vulnerable communities across a lot of suburbs. What information can you tell us about the outbreak in the Redfern towers and what's being done, and how concerned are you?
What we're seeing, and I think it's been said many times at these press conferences, is that this virus is effectively identifying and moving in on the socially disadvantaged, and obviously the Indigenous communities, and that's everywhere really. So Redfern and Waterloo, I know I was the housing minister for a year or so, and I was often down there talking to the residents, and there are many, many people in that area who are very socially disadvantaged and haven't yet actually been vaccinated. Health is doing everything it can to have pop-up arrangements and other arrangements there to get the vaccination rates up. That remains the key. I don't know, Dr. Gale might have. Do you want to add anything to that?
Just with that pop-up stuff especially.
Just ask Dr. Gale. I'll come back.
And do we know what the vaccination rates are roughly in that area?
Yes, thank you. As the Minister said, really since very early on in the pandemic, there's been a lot of engagement with people who live in social housing, as well as with all the agencies, both governments, the Department of Communities and Justice, as well as many NGOs who work with communities experiencing disadvantage, community housing providers, to prepare ourselves as best as possible to support those communities in the context of COVID-19. And those efforts range from, having access to testing, and that's been in place for, since March last year. Supporting communities with education, sessions, engagement, and vaccination access. In relation to the Redfern Towers in particular, I understand that there are 12 cases across the 3 buildings, which accommodates approximately, I think it's 630 people. And there have been a lot of efforts going in to support residents of those buildings even before these cases emerged. So there have been regular testing and outreach and vaccination clinics run in those housing areas by both Sydney Local Health District and as well by the Kirchen Road Centre from southeastern Sydney Local Health District. And really good efforts made to have regular access to testing. I believe there was a pop-up testing clinic there where more than 330 local residents have already been tested so far this week. And I understand that around 2/3 of the residents of those housing towers in Redfern have been vaccinated. And I believe that there are staff on site again today there for testing, for vaccination, and to provide supports to the residents of those buildings, including food items where people need it, other medical supports, supports for pets. So there's a lot of efforts underway with health services, as well as with the Department of Communities and Justice, as well as multiple other NGOs.
Sorry, when you say 2/3, is that full vaccination or single dose?
I don't know exactly, but at least 2/3 have had at least one dose.
Doctor, can I ask you, and maybe you or the Minister could answer this, just talking about the Lismore LGA and the lockdown that's being imposed there, we know that northern New South Wales does have a higher rate of vaccine hesitancy, and some people are just outright anti-vaxxers. Is that one of the factors that has played into the decision to lock down the Lismore City LGA?
There are a suite of factors, but the main driver really for that prompt decision is because of the case that is there, for the school exposure, as the Deputy Premier outlined, and because of the exposures in the community broadly. And, I'm sure if that was in another LGA, we would probably make a similar decision. But clearly, knowing some of the vaccine hesitancy in that particular area itself, we would have a higher level of caution. But the main reason really is because of that case and the exposures in the local community, and hence that recommendation for the stay-at-home order. which is really important for residents of that area to come forward for testing, keep an eye on any exposure venues listed, and of course please come forward for vaccination. And we understand that there will be a segment of the population who have strong views about it, but I feel really confident that the vast majority of the population in the Lismore area and as well in New South Wales are really embracing vaccination, are educating themselves, talking to their families, talking to their communities about it. And personally, I feel really confident that in New South Wales we can achieve very high rates of vaccination coverage, and I think the data so far that we're already edging over 80% of first dose is a testament to that. And as we get greater vaccine supplies in and more Pfizer, particularly in the month of October, we're really going to see those rates further increase. And again, a big thank you to the people of New South Wales, and I really think that we can achieve some of the highest vaccine coverage in the world in New South Wales.
Have we peaked? Have we reached the peak? Have we seen it?
Look, I would love to think so. However, it's pleasing at the moment to see our case numbers stable. Of course, we do know that they bounce around a little bit, and we anticipate that to happen. We know that even single exposures or single events can cause a peak in numbers, and I think all of us, as we've been on this journey with COVID, have observed occasions where that has happened. So I can't hand on heart say that we've peaked. I'd like to think we have. However, we continue to have a conservative approach. We're cautiously optimistic, seeing these numbers being relatively stable day to day, bouncing around a bit. We may yet see an increase, but really the key thing for all of us, and this is really, as Dr. Chant has said in the past, this is in our collective hands. And to see the numbers continue to be stable and preferably decline as soon as possible is really something that is in all of our hands. It's about every single individual following the public health orders. It's about every single individual, if you have even the mildest of symptoms, to come forward for testing promptly, and that's critically important. It's about every single individual making that decision to get vaccinated and talk to their families and encourage their community to do the same. It's those individual acts that will get us through this, and that we want to really see those numbers decline. So it is in our hands, and that's our challenge.
We've done a social housing block. 630 roughly residents, all 12 so far test positive, isolating for the appropriate amount of days. The other residents just isolate until they get a negative result. Are you confident that that's a safe living situation for 630 people to be in blocks with people, at least 12 people who are positive? And what's also being done to support those who do have to isolate in terms of food and essential supplies?
Yeah, thank you. That's a great question. And clearly it's a challenge. And we know for many families who might live in households that are crowded, it's easy to say isolate from everybody, but we understand that practically that's difficult to do for many communities, including residents of Redfern, as it is for others. There's a lot of work being done to support people in safe accommodation where that is needed. We have our special health accommodation, and they're continually looking to create other options where people can be moved to be able to safely isolate. And certainly for the residents of the Redfern blocks, for those who are unable to safely isolate in their home, those options are being explored for them, and some people, are in the process of looking at moving. And our teams and health teams will be doing their best to ensure all the supports are there for people to be able to safely isolate, that people have all the information that they need around mask wearing, cleaning products in the home, all of those sorts of informations, not sharing bathrooms, trying to sleep in separate bedrooms, wherever possible to support people to safely isolate. But there are options of different accommodation for those people for whom it is particularly difficult to isolate at home.
Minister, two people who died today.
Sorry, Ashley, just before you do that, notice I didn't realise that I had that information here, but just to indicate, back to your question, the specifics, 91% of staff at metropolitan local health districts have had their first dose, and 86% are fully vaccinated, so that's incredible in metropolitan local health districts. And 88% of New South Wales health workforce overall has received one dose of the vaccine, and 80% have received 2 doses. So it really is really positive. It's a little less in the regional areas. 84% of staff at regional health districts have had their first dose. So we're doing really well on that front. I'll come back to you in a sec. Ashley.
Two people who died today were from the western suburbs or southwest Sydney, but they died in Northern Beaches Hospital. Is this a reflection of the stress that is occurring in those western or southwestern hospitals, that they had to be moved prior to their death and cared for so far away from home?
Look, I think we've had ICU specialists here. I think you were here for at least one of them. And I remember Dr. Nguyen also was making the point, as was Dr. Burns, that it's part of the normal system when you have patients who are obviously occupying beds in the intensive care units, to move patients around, and that way they are given the sort of quality first-class health service that New South Wales can provide. If you're asking me whether the health system is under stress, I think I've said that many times. Of course it's under stress, but it's stress that's being managed quite well, actually. So I don't see any huge ramifications or things that come out of that. It's just a case of, yes, the system's under stress, but every patient is being moved into a location where they can get absolute world-class health service. Sorry.
Yes, can you confirm that New South Wales Health has requested support from the ACT for the use of hospital beds in Canberra once the state is opening up?
Once the state is opening up? I can't confirm that. I don't know the answer to that. But we generally work very closely with the ACT. There are a lot of patients that travel back and forth, particularly in that area down towards Queanbeyan and so on, that the Deputy Premier would well know. So normal activity to be working with those two major hospitals in the ACT. So it wouldn't surprise me if it has, but I don't know the answer categorically. Can I just say, one of the things that just struck me as I was listening to the questioning is that we really do have to get the message out that people need to get vaccinated, no matter where you are. I just did a quick calculation. It's 100 days today till Christmas. The best present you can give yourself, your family, your friends and the state is to get vaccinated. That will be the best Christmas present. So 100 days from Christmas, go and do it.
What happens to healthcare staff who haven't had their first dose?
Just do you mind, because that lady... Yeah.
Sorry, Minister, a few local state representatives have written to you requesting either a mass vaccination centre in the eastern suburbs or more pop-ups in Sydney LGA. Are you going to grant those requests? There's concern about vaccine access in those two areas.
Can I say it's not a matter of me granting. The health team has to obviously make those decisions. I'm the Minister, not the clinician. But what I can say is I've had numerous discussions and have them every day with our senior health staff. And there's a lot of staff that have been taken offline to do those mass vaccination hubs. We just had Ashley obviously talking about moving patients around. So there is a limited number of staff to be able to do all of these mass vaccination hubs. And sometimes it's not about the mass vaccination hubs, as they tell me. It's more about the tailored local services. And there are lots of GPs these days, lots of pharmacists who can give the vaccines. So, in fact, I quite often talk to my colleagues about, in some local areas, they would prefer to have more tailored, smaller services coming, somewhat bigger ones. But at the end of the day, it's the health experts who run the health system who determine where the best bang for your buck is, in a sense, of your staff going where. So all I can say is that I always convey those thoughts to the senior health staff, but they make the decisions. And so far, New South Wales really has the community and the health team who work together amazingly well. And we've got an incredible rate of vaccine. The numbers of people who are now vaccinated, I could only have dreamt about last year. And it was a dream last year because we didn't have any vaccine, but the number we've had vaccinated is incredible. So I think what the team is doing at the moment is the right approach. Sorry. Yeah.
In terms of healthcare staff, we're quickly approaching that first dose vaccine mandate deadline. What happens to staff who haven't had that first dose by that time, and what plans are in place to fill potential job shortages?
Look, the issue there was right from the outset. We had meetings with the private hospitals and all the public system. And what we looked at was the number of people who, the medical people like to call it furloughed, but it means basically taken offline if you're a close contact or a positive case. And what we found was that, for example, in Victoria last year, when they had similar challenges, there were literally thousands of staff that had to be taken offline. So on balance, the decision was taken that even if there were some who chose not to be vaccinated, and it's a very disappointing position if they do, that we are still far better off than we would be if we didn't have that mandatory requirement. So the decision was taken in a sensible, I think, and balanced way. And certainly all of the hospital staff that were involved, the hospital management, keen to make it mandatory. I've had I've had the heads of colleges contact me and say that their members don't like working with people who are not vaccinated because they're putting their fellows at risk, their fellow clinicians. There is no alternative but to be vaccinated. If you work in the health system, you have an obligation, first of all yourself, to make sure that you stay healthy and fit and are on the front line in what is a pandemic, what is a war. But secondly, you have an obligation to the patients. Patients come into our hospitals in the expectation that they'll be kept safe. So whatever the consequences may be, there is no other choice. They have to get vaccinated.
So,
Sorry, can I just go, Liz?
I follow up on that point, Minister. To the question, though, what happens to a staff member who's a full-time staff member who refuses to get vaccinated? Will they still be paid?
Those matters are still under discussion, but I think suffice to say that if you're in a position where you're putting your colleagues or your patients at risk, you probably can't continue in that position, but we're working through that. I mean, I know the media like to jump to what's the worst case scenario. I'm the Minister and I like to look at what the best case scenario is.
But this will happen, though, and we're not far away from it happening.
Look, you'd like to think that, you'd like me to jump on that, but I'm a lot calmer.
What incentive, though, how do you get people over the line?
So health staff have to be fully vaccinated by November 30. So the rules are stricter.
Sorry, I just missed the start.
November 30 is when health staff must be fully vaccinated.
Fully vaccinated, yeah.
Yeah, so the rules are stricter for hospitality than they are for the health system with the fully vaccination rule. They'll have to have that a month and a half earlier to be able to work in a restaurant or a cafe. Businesses are asking how that's fair.
Look, I think that you can certainly say, is this fair or is this not fair, in a whole range of areas when you're in the middle of a pandemic. Those were the rules that were set and those are the rules that are going to apply. Yes.
Minister, do you have any update on the bulk carrier that's off the coast of New South Wales and how that crew are?
It's just before we came down. Yeah. I don't, but I'll just check whether Dr. Gale. I'll ask Dr. Gale.
Just if we have any update on the cases or the condition of the crew?
I think I was told, correct me if I'm wrong, but I think I was told there are 11 cases that I believe are positive, and they're still working through with the ship and others that what they should do about that. But do you have any? That's it. Sorry.
Can I ask you about an anti-lockdown protester who you're probably familiar with? He became quite famous on TikTok because he.
Oh, I'm very familiar with him, yes.
He's now contracted COVID-19. Can you muster much sympathy for that person?
Look, I would say I have sympathy for anybody who gets COVID. COVID can actually kill you. And so, even though I might be frustrated with that gentleman's juvenile way of approaching the situation, I think the rest of us in the community would say we still have sympathy with the fact that he's now got it, because obviously that puts him at risk. It puts close contacts at risk. But there's a very strong message there, and that is don't take this trivially. Don't be silly about it. Take every aspect of COVID-19 seriously, and that means get vaccinated.
Minister, are you aware of any plans that are in place for people who've been in hospital and then they're discharged from hospital with COVID to be checked on or make sure that they're okay when they get back into the community as they recover? Because we're just hearing through community centres that people are being left at home, they're concerned that they're not being checked on or they don't have enough food, etc.
It's interesting, isn't it? I mean, the issues around food, you wouldn't normally expect the health system to be doing that, but the health system has taken that on as well, and working with Resilience New South Wales and working with the other government agencies. And generally there should be outreach to those people through one of those agencies. I don't know whether Dr. Gale can add anything. Yeah, Dr. Gale might add something to that.
So for people with COVID who are being cared for at home for their period, which is mostly 14 days for most people who test positive to COVID, so there are a range of supports that are available there to them. So the clinical teams check in with them regularly, and any issues for people, like if they need food or other kinds of support or other medication, there are mechanisms in place to refer people, including through Resilience, as well as many local NGOs and, for example, local councils in many areas are doing a fantastic job, and there's many organisations out there who are working hard to support people with COVID who are in isolation. For people, once they've recovered after a 14-day period, we know that a certain proportion of people may continue to experience effects from the infection for some period of time afterwards. And for those people, while our health services will continue to be available, and for some individuals with complex issues we'll continue to support them, we also rely on our wonderful network of GPs who are also there to support people with COVID, including after their infection. And our GPs are doing a terrific job in testing people who come forward, in vaccinating people, but also playing a key role in caring for people with COVID. And also once their period of infection, or when they're no longer infectious, has ended, but that's not to say they may not have ongoing medical needs. And for like everybody in our community, that essential primary care function is there for our GPs. And I just want to say a big thank you to all our GPs for the wonderful work that they're doing. Managing COVID on top of everything else that GPs normally do for us in the community is really significant, and they're doing a wonderful job.
Just Dr. Gale, just for Dr. Gale, for fully vaccinated healthcare staff, if there's an outbreak, say, in a facility and they're a close contact, will the requirement for them to be isolating reduce so that it helps take the pressure off the system?
Yeah, that's a great question. We're looking at the moment around how we manage instances of exposure when people who are fully vaccinated are involved, and particularly in high-risk settings like in a hospital setting. And so we're in the process of looking at the international evidence around that, looking at what other jurisdictions are doing. Currently, with the framework we have in place in New South Wales for people who are exposed, they are where we think the risk is significant, and we have a fairly complex matrix that we use to assess those situations. People who we think are at risk are put away for 14 days as close contacts and to isolate. We're working through the issues of what fully vaccinated, how that might change for people who are fully vaccinated. So I think that will be an evolving space. So, you know, that's just one of the many changes that we're going to make as we progress in thinking around how we manage people who are exposed to COVID in the weeks and the months to come.
Can I just add on actually that I was up in the far west and west recently, and I was just blown away by the work that was going on to make sure that people in their homes are being well cared for. In Dubbo, I actually saw health staff, but also SES, Rural Fire Service, other volunteers there, making sure that food bank supplies were going out to the Indigenous and non-Indigenous community. And when up in Walgett and Brewarrina and Wilcannia, similar issues occurring. Lots of volunteers. Interestingly, in Wilcannia, I even met the local deputy principal, actually, Sarah, who was looking after getting all the food together for the local community. Those issues are issues which really are, I mean, during a pandemic, having all of these volunteers come together. In fact, there was a nurse there, Lizzie, who was a nurse during working hours and then came down straight away in her off hours to volunteer with regard to food. So I'd say everything is being done that can be done right across the state, but there may be people who have missed out on that. If there are, then I would just strongly encourage them to contact their local health district and make sure and the health district or the local volunteers will get the food to them or get the other support. But particularly GPs are there also to look after their ongoing health care as well. Sorry.
Just a question for the Deputy Premier.
Question?
Yeah.
Okay.
Deputy Premier, the latest jobless figures are out, and they show that the New South Wales, the unemployment rate has risen to 4.9%. Another 170,000 people lost their jobs in August, and hours are down as well. How concerning is that? And does the state government take any responsibility with how the lockdown and restrictions have been managed on the impact?
Well, this is the real cost of the pandemic in a way, that the economy had to be shut down, jobs were lost, businesses on the brink of closure, and more of that pain continues until we get out of lockdown and we get on the roadmap at 70% double vaccination and 80% above. But this is the reality of the pandemic, right across the globe. Economies have been brought to their knees, and it's no different to New South Wales. The only thing I'd point to is that the JobSaver payments that are partly funded by the New South Wales government, I should say 2/3 funded, something like $8.9 billion of state funding has already gone into business support, another $3.5 billion from the federal government into business support. It's all about making sure these businesses survive this period so that when the doors open, that we are able to bounce back. And if you look at last year when we went into the pandemic, not only did we get all those jobs back, but we're actually 30,000 new jobs above. So that's been our plan, and the Treasurer has already indicated a recovery package once we hit October and reopening. So we look forward to that. I'm confident that the economy will bounce back. We are New South Wales. We are the engine room for the nation. We're talking about international arrivals. We've got a roadmap out well before any other state. We're being cautious, but we're also being bold. And we're confident that with the business owners of this state, and let's not kid ourselves, small business, medium business have borne the brunt of it. That's mum and dad business owners, individuals that have mortgaged their homes, gambled their future to be the small business economy, creating the hundreds of thousands of jobs in this state. It's not government and it's not politicians that create jobs, it's actual small business owners that show that courage, and our job is to make sure they survive this pandemic, more importantly, bounce back, and I look forward to more information from the Treasurer in relation to recovery.
You mentioned there the roadmap out. We're set to reach 80% double dose a couple of weeks after reaching 70%. When will we see an 80% roadmap?
Oh, look, you know, I can say that, and as the Premier's touched on, there's an 80% roadmap that we've got in draft form. We've been working on it. That work was in parallel with the 70% roadmap. Look, you know, if we reach those targets earlier, we can be bold. If we get first dose vaccinations up above 85 or into 90%, as Dr. Chen has really been keen to encourage and make Australia the most vaccinated nation, New South Wales to lead that. That'll give us other opportunities. But look, the Premier has indicated in the next couple of weeks we'll say more about the 80% roadmap. We'll say more about unvaccinated people. We'll say more about major events. We'll say more about what Christmas looks like for so many families. Thank you.
Thanks, everybody. Thank you very much. And thanks to our online interpreters. Thank you very much.
Thank you.